there, my name is Kristen Struble. I'm a practicing pediatrician in Phoenix, Arizona. I'm going to talk to you today about who I am and a book I wrote called How to Be a Poop Detective. Kind of tell you why I was inspired to write the book. So I've been practicing pediatrics in Phoenix, Arizona since 2001. I actually went to University of Arizona and then trained at Phoenix Children's Hospital and then have been in private practice since then. So it's been really, really fun. I'm honored to do it. But in my daily practice, I have noticed that many kids come in with different diseases, whether it's asthma, eczema, constipation, abdominal pain, urinary tract infections. And I really have seen over the course of those years that I've been in practice how much that relates to the gut. So I talk to families every day about the connection, and that's what the book is about. So I do encourage you to go to my website because I have a lot more information about who I am, and also it will connect you to my Facebook page, which also I put articles on every day and tips and just lots of things I really feel that you all might be able to learn from. So in my book, I highlight what I call the 5 S's. So when patients come in my practice and have different things going on, like I said, if they have chronic sinus infections or anything chronic, because kids should really be healthy, right? Especially if they have come in with abdominal pain, I will ask them specifically, what's your poop like? Do you poop every day? Parents oftentimes will say, oh, yes, they do. But really, once a kid's closing the door, in private, parents oftentimes don't really know what's going on behind closed doors, and kids oftentimes won't realize that they have an issue. So I highlight the 5 S's, what I call the 5 S's in my book, which number 1 is shape, number 2 is soft, number 3 is sink, number 4 is shade, and number 5 is shoot. So I actually will draw poop shape for kids because this is the easiest way to identify if there is an issue. So really, poop should look like, obviously it should look like logs or small hot dogs. Not redwoods, so not massive poops. They shouldn't look like torpedoes. They shouldn't look like rabbit turds, I call them, or little meatballs. They shouldn't look like baseballs. They shouldn't look like footballs. So oftentimes I will have them point to the poop that they have, pretty much which one is the most common. And these are the most common shapes. So if you are familiar with the Bristol scale, in my experience, does not apply to kids because the Bristol scale was an adult study to kind of describe to adults to help them to identify if there's an issue. But this is what I see on a daily basis if a kiddo has a lot of disease states. So we talk about this, and then I also say, when your poop comes out, does it feel like it's hard? Oftentimes, if they have these guys, they hurt. In fact, sometimes they'll even say when I wipe, I have blood on my toilet paper, or they'll clog the toilet a lot. These are all little clues to identify, does your child have a poop issue? Number 3, do they sink? Well, that's not the biggest message that I have, but really if they're floating a lot, they're not absorbing well, which is kind of a sign of an inflamed gut too, or they're eating a lot of processed foods, which again, not great for the gut. So shade, it should be brown, it shouldn't be red, unless you've had beets the day before, but there shouldn't be consistently what looks like blood. And it shouldn't be black, that's a problem too, so it should be brown. And then it should shoot out, actually. So reason I say that is because a lot of parents think that when their kids are in the bathroom hanging out, they're playing their iPad or they're reading books, when in reality they're in there pushing really hard. It's painful to go. And it should really be easy. You should go into the bathroom, sit on the toilet, and it should come out. I actually wrote a book, or a second edition of my book, marketing Squatty Potty, because that is one of the products out there that really does facilitate the shoot part. So it helps put your kiddos and us in a position where we're squatting, which is what we're really supposed to do as human beings. So But anyways, I actually would encourage y'all to take a look at my website, go to my Facebook page, and read a little bit more about the book. After I talk about this, then I talk about diet and what triggers this, and that will be in my next video. So hope you enjoyed this little segment, and hope you look forward to the next one. Thanks for joining me. Have a great day.